Hi, Kavita. I see you just joined us. Would you like to do a microphone test?
Yes, can you hear me?
I can hear you. Thank you very much.
Thank you.
And Sylvia, I see you just joined us. Would you like to do a quick mic test?
Yes. Hi. Good afternoon, everyone.
Thank you. I can hear you. And Molly O'Neill, I see you've just joined us as well. Would you like to do a quick mic test?
Good afternoon.
I can hear you. Thank you very much.
Thank you.
Chief Garnett, I see you just joined us as well. Would you like to do a mic test?
I would. Can you hear me?
Yes, indeed. Thank you very much.
Great. Thank you. Have a good meeting.
Thank you.
Dave, do you see if Supervisor Wasserman has joined us?
He's not in yet.
All right. It is 1:58, hoping to begin at 2 o'clock sharp. There he is. Hey, Supervisor Wasserman.
Supervisor Ellenberg.
All right. It is 2 o'clock, and I am prepared to call this meeting of the Public Safety and Justice Committee on February 4th, 2021 to order at 2 p.m. And I will ask the clerk to do a roll call, please.
Vice Chairperson Wasserman
Here.
and Chairperson Ellenberg.
I'm here as well. Thank you very much. We'll move now to public comment. This portion of the meeting is reserved for public speakers who wish to comment on items not on the agenda, but within the purview of this committee. If we have fewer than 6 public speakers today, we will allocate 3 minutes each. How many do we have, please?
We have 4 speakers at the moment, 6.
6. Okay, takes us to the 2-minute mark. Let's just give it maybe 10 more seconds to see if anyone else joins. If you do intend to speak on public comment, please raise your hand or call in now. And if we're still 10 or under, we'll keep it at 2 minutes.
Okay, 2 minutes it is, and we're still at 6.
Okay, thanks, Nancy. Let's get started.
Sure. Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. Hopefully you can hear me. I'm actually wearing a set of headphones.
Yes.
Oh, great. Thank you, Mike. Mic check. There we go. Appreciate that, bud. Now, what I'm trying to do out here right now, I'm actually out on Spring Street right now. I'm doing a little recording. They're out here doing a beautification cleanup out here. And what this is doing is it's absolutely scaring everyone out here. Now, during the pandemic, of course, you know, zero bail, no one has a place to go. It's been very difficult, but this is just mean. This is very mean to do to people. We've been doing warrant checks out here now. We're pulling people out of cars in the middle of the night. And Tucker Construction, man, they're making big dough now. They've got all these new vehicles. And this just comes across as absolutely inhumane and wrong. And I know recent articles, we've had problems with crime with the businesses that are running along the Coleman area right there. You know, I totally get that. And behind those fences, we have the worst of the worst. People that they're not on cash aid, they're not on food stamps, they're on a lot of meth, and they're causing a lot of chaos. But our county and city doesn't want to vet these people out and figure the ones that are the loners, that are sober, that are trying to survive, and the ones that really need to be locked up and put away. And I think this is the same case with our mental health system. These people need to be put on holds. They need adequate care. What we need from the public is to put some money together, get a lawyer, and file a federal lawsuit. Because what we need is a federal injunction. And that's what's going on in Santa Cruz County right now, Sacramento County, and that's what the California National Homeless Union is really pushing forward right now to start doing. I am very concerned that you guys are not going to do anything for these people. And case in point, out here right now, I mean, it looks like they're even putting up fences and they're giving notices to people that shouldn't even be receiving this during a pandemic. What is going on?
Our next speaker is Leslie Zeiger. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Leslie Zeiger. I am a member of Showing Up for Racial Justice at Sacred Heart, and I live and vote in Supervisor Simitian's district. At the January 26 Board of Supervisors meeting, I was gratified to hear Supervisor Ellenberg propose an authentic community engagement process to research alternatives to a carceral facility. I want to lift up Supervisor Ellenberg's assertion that those directly impacted by incarceration must have a leading role in this process. They are the experts of their experience. Instead of grasping onto what is and what has always been, let's ask what could be. I challenge you, the county departments reporting to the PSJC, the county executive staff, and the Board of Supervisors to center people, not buildings. Start the community process at the March 4 PSJC meeting. Thank you.
Our next speaker is Catherine. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Catherine Ono. I am also a member of Showing Up for Racial Justice at Sacred Heart, and I live in Supervisor Ellenberg's district. At the January 26th Board of Supervisors meeting, I was gratified to hear Supervisor Ellenberg propose an authentic community engagement process to research alternatives to a carceral facility. I want to lift up Supervisor Ellenberg's assertion that those directly impacted by incarceration must have a leading role in this process. They are the experts of their experience. Instead of grasping onto what is and what has always been, let's ask what could be. I challenge you, the county departments reporting to the Public Safety and Justice Committee, the county executive staff, and the Board of Supervisors to center people, not buildings. Start the community process at the March 4th PSJC meeting. Thank you.
Our next speaker is the caller ending in phone number 416. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Meredith Hurley. I'm also a member of Showing Up for Racial Justice at Sacred Heart, and I live and vote in Supervisor Ellenberg's district. I was really heartened to hear Supervisor Ellenberg's proposal at the January 26th Board of Supervisors meeting to have an authentic and meaningful community engagement process to research alternatives to a carceral facility. I really want to lift up her assertion that those directly impacted by incarceration must have a leading role in this process. They are the experts of their experience, and I think it's very important that we listen to them and include them as well as other community members. Instead of grasping onto what is and what has always been, let's ask what could be. Another world is possible, and I'd love to see Santa Clara County be a leader in dreaming that new world. And I challenge you, the county departments reporting to the PSJC, the county executive staff, and the Board of Supervisors to center people and not buildings, and start the community process at the March 4th PSJC meeting. Thank you.
Our next speaker is Aisha Abbott. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi there, my name is Asha Abbott, and I am a social justice advocacy intern with YWCA Golden Gate, Silicon Valley, and I live in Supervisor Wasserman's district. I'd like to follow up on a few items that have been discussed at past meetings. If I remember correctly, and please correct me if I'm wrong, but Supervisor Chavez had stated wanting to place emphasis on the amount of affordable and supportive housing / shelter made available for survivors of domestic violence. And relating to this pandemic, I'm wondering if there's been any recent progress made to making housing more accessible and available for this population. And then I also wanted to follow up with any progress being made in regards to replacing the idea of the new jail with a new mental health treatment facility? And if so, what progress has been made? And are there other possibilities that the funding could be used towards, that the funding that was going to be used for the jail could be used more towards community services or developments for supportive and affordable housing? Thank you.
Our next speaker is Diana Rendler. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Diana Rendler. I'm also a member of Showing Up for Racial Justice at Sacred Heart, and I live and go to school in District 3. As some of my fellow Surgers have said here today, I was very happy to hear about Supervisor Ellensberg's community engagement process as mentioned at the board meeting on January 26th. I want to lift up her assertion that those directly impacted by incarceration must have a leading role in this process. We know that part of incarceration is based on class and race. And so these people likely have different experiences than those of us who are able to be outside of the carceral system, and they're the experts of their own experience and they have knowledge that we do not. And this, including them and centering their voices, gives us the chance to imagine alternatives and to ask what could be, how much better could it be if we really listen to these people's experiences. So I challenge you, the county's departments reporting to the PSJC, the county executive staff, and the Board of Supervisors to center people and not buildings. Start the community process at the March 4th meeting. Thank you.
Our next speaker is Molly McLeod. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Molly McLeod, and the United States is #1 at locking people up and spends an inordinate amount of money on this. Thinking of California's investment in the carceral systems, something like 22 prisons were built. At the same time, only a couple of UC campuses were. So it was a surprise in these COVID pandemic times to many that releasing people actually didn't have a substantial effect on safety, but locking up hurt people and continuing generational cycles of trauma isn't a solution. And I think that we've really, as a US society and also locally, you can see, these are the broken systems, but what is it going to take to make substantive change? I know I've spoken before the Board of Supervisors at the Blue Ribbon Commission, about health conditions, about, being locked up, about many different aspects. And I received significant support from Silicon Valley Debug, those community-based resources, the ones that look at alternatives that are home-based. So they're the healthiest environments possible when you do services that make a difference. I'm also speaking as a white woman who adopted sons from foster care. And when I think about the finances that are given to strangers to take care of children, as opposed to actually investing in keeping families together and communities together. So let's reimagine a different future. Thanks for your consideration.
Our next speaker is Jose Valle with Silicon Valley Debug. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, how you doing? This is Jose Valle with Silicon Valley Debug. And I'm very appreciative that visits have opened up. I'm also very appreciative that the custody staff went ahead and verbalized that they're going to go ahead and start following guidelines. But what I'm going ahead and comment on is that we really need further answers and accountability for the atrocities of having individuals positive with COVID-19 inside of cells full of feces and blood, both in the women's facility and in the main jail. If we would have heard something like that coming off a public business, a park, Kaiser Permanente, Valley Medical, any of these places, I'm sure there would be swift actions taken against these public places or private businesses. And for whatever reason, people are turning a blind eye because people inside of our county jail are looked at less than human. Thank you, appreciate it.
And that concludes our public comment.
Thank you very much. With that, then we'll move on to the consent calendar. Right now, only item 9, the minutes from January 7th, is on the consent calendar. Supervisor Wasserman, if you are in agreement, I would like to add item 6 to consent. That's the semi-annual report from the ESA on extra help hours.
Thank you, Madam Chair. I'll take that as a motion from you to add number 6. And I believe you meant it was item number 11 that was on consent, not number 9. Or did you want to add number 9 in addition?
Oh, sorry, why did I have to? Nope, I did not. I was just looking at the minutes and I think I had the wrong number. My apologies.
Okay. I'll make a motion, if I may, to approve items 6 and 11 under the consent calendar.
Thank you very much. I'll second it. Do we have any speakers on the consent calendar, please?
No, we do not.
All right, thank you. Then we'll have a roll call vote to approve the consent calendar.
Chairperson Wasserman?
Oh, yes.
And Chairperson Ellenberg?
Yes.
Thank you.
Thank you very much. That takes us to item 4, which is to receive verbal reports from departments on response to COVID-19. My usual caveat that each department isn't obligated to make a presentation if things are going along as usual. There's no need to share. Happy to have updates. And we'll pause after each report, Martha, just briefly to see if anyone has questions.
Thank you. With that, we're going to go ahead and start with Superior Court. Judge Zahner?
Thank you. The only update since last time is that with the lifting of the regional stay-home orders this week, we have cautiously and carefully resumed jury trials in both the criminal division and the civil division. I believe we have one case in jury selection right now in the civil building, and we may have two going in the criminal division.
Thank you, Judge. Supervisor Wasserman, any questions?
No, ma'am.
All right.
Okay, with that, we'll move on to District Attorney Rosen, please.
Yes, good afternoon. Two quick updates. The public defender and I spoke to Dr. Sarah Cody a couple days ago to ask about having the frontline workers in our respective offices who go to court and interact closely with members of the public in confined spaces to see what could be done to get those individuals within our offices vaccinated or at least on the waiting list if there are extra vaccines available, because between our two offices, we have really in excess of about 150 people that are continuously going back and forth to court. So Dr. Cody was going to speak about that with others at the EOC and get back to us. And we hope there's something that can be done to help our staff. The second thing I would mention is just between the budget cuts and the voluntary incentives for folks to retire. And then we have dozens of DA staff that have been reassigned to work as disaster service workers. Our clerical staff is down more than 20%. And that's beginning to affect our operations, and we can't do things as quickly as we can, and they're important things. So I think it's important for the supervisors and the county executive's office to understand that having the number of employees that the DA's office has agreed to reassign as disaster service workers does have real effects on our ability to do justice and meet our constitutional obligations. Thank you.
Thank you. Questions?
Nope.
All right, thanks.
With that, we'll move on to the Sheriff's Office. Sheriff Smith?
Thank you. I think that Assistant Sheriff Davis is sitting with our COVID unit and will be doing and his staff will be doing the presentation.
Good afternoon, supervisors. In the room with me, we have Under Sheriff Bender, Assistant Sheriff Rodriguez, Assistant Sheriff Doty, Lieutenant Asbin, and Sergeant Menchaca, myself, obviously A.S. Davis. So to kick us off, we're going to refer to Sergeant Menchaca. She's going to go over our COVID update.
Hi, good afternoon. Today we have 13 Sheriff's Office employees and 9 inmates in isolation with COVID-19. We do want to speak about rapid testing, our daily rapid testing. The response to the daily rapid testing has been well received from staff assigned to the congregate settings, and they are tested daily. The Custody Bureau is 100% in compliance with our daily rapid testing since January 1st. According to the divisions, there have been 0 refusals. A recent audit was conducted by myself and Lieutenant Asbin and revealed some discrepancies in our denominator. The staff that were included in our denominator either were out on injury, maternity leave, paternity leave, out on vacation, some type of injury, or were assigned to other units and that don't have contact with inmates. Also, some of the staff were not able to participate in the COVID testing due to being COVID-19 positive within 90 days or within 90 days. So they're not able to test in that 90-day period. So there have been benefits to the rapid testing. Being able to identify COVID-19 positive staff quickly and isolate them has assisted in potential outbreaks with staff and inmates. And we do want to recognize Custody Health for their hard work and their service that they provide to our staff daily. To date, we have 14 staff, sworn and non-sworn, in our custody bureau that have tested positive through rapid testing. Due to that rapid testing, there has been no impact in our staffing levels or in our daily operations. I do want to mention that to kind of go back, January 8th, we did have 118 COVID-19 positive inmates in our care. And so the downward trend has been significant. In regards to our dashboard, we continue to experience issues with the database our data provider is utilizing. There is no estimated date when the dashboard will be updated. However, at this time, the employee portal and patient update totals will be updated until we're able to receive other data that's needed. We wanted to touch a little bit on vaccination. Our first round has been completed, and we have 1,847 staff that have been vaccinated. In our custody bureau specifically, 447 staff or sworn staff and 107 civilian staff have been vaccinated. It was conducted seamlessly, and there was no impact to staffing levels or daily operations. The COVID team is aware of 3 staff members that had reactions from the vaccine. The impact, again, there was no impact to staff or the operation. And the people that did suffer those side effects, it was no longer than 24 hours. Other than that, that is the end of my report.
Thank you.
Thank you. Supervisor Wasserman, do you have questions?
No, ma'am.
All right, I do have some, please. As I am concerned that the dashboard hasn't been updated for inmates' COVID cases since January 18th, 2021. I appreciate that the staff dashboard was updated, but only within the last couple of hours. So haven't had an opportunity to fully review that. The dashboard provides really the only insight for the public into the status of in custody cases, and not even having a date as to when that might come back up is concerning. Is there additional IT support that we might temporarily direct to help move that along? What are the barriers? In other words, what do you need to make this happen faster?
Not necessarily the barriers, ma'am. It is a combination, a concerted effort with Custody Health Services and the HealthLink/Epic system. Right now, the system is tracking so many tests on a daily basis, and the turnaround of the lab results can vary from 24 to 48 hours. And when our internal IT staff review those numbers and package the numbers up for our daily dashboard, it doesn't truly speak to the reality of the true values of the labs that we receive.
Then perhaps we need a different system. I understand the 24, 48 hours, but we're now looking at more than 3 weeks of not having information. Can we think creatively about another way to get this information public more quickly and more regularly? And Dr. Smith, I'm happy for you to weigh in as well, or Dr. Day, if you have suggestions, because again, this is critical information that the public deserves to have access to, or is entitled to have access to.
Thank you, Supervisor. I'm not aware of exactly the nature of the problem, but we'll get on it and work with the Sheriff's Department to get it straightened out.
Thank you. I appreciate that. My staff has also made the request that inmate data be further broken down by cases identified during booking versus cases from in custody transmission. And I do understand that the IT department has been looking into how to make this data available, and I would like to see that incorporated into the dashboard when it comes back online. Is that problematic in any way for anyone?
Yeah, that's possible as soon as we get the information that is needed.
Okay, great. Thank you very much. I am pleased that the family visits have resumed. The last time they were put on hold, inmates and families had been told that visits would resume once the county was out of its latest lockdown. However, the hold was initiated before the county locked down again. So could you clarify for me what incidents trigger or what conditions trigger a hold on visitations?
Yeah, I can speak to that, Supervisor.
Thanks.
There wasn't any specific trigger, I wouldn't say, except that we had a rapid rise in COVID positive cases, coupled with additional efforts to try and test staff, test inmates. It was just a coming together of numerous things to where custody health and custody staff had agreed that this would be the best step for now until we could try to contain it. And then after consulting with public health and coming to the conclusion that cases were going from the high of 118 down to the 9 positives today, which is just significant,
right.
We were able to open visiting back up. Future triggers, we're not going to have future triggers. Is what we're going to have is we're going to focus on the collaboration, and we're going to put greater weight on public health and their recommendations to us. We would like them to be an equal partner for obvious reasons. And if the concerns between custody health, public health, and custody determine that we would need to shut down visiting, then we'll broadcast that. But otherwise, we're going to continue to extend visiting as long as possible.
Thanks. I'm really glad to hear that. I know you know better than I do what a tremendous difference that makes for our population in custody. I heard the numbers early in the report that you gave, both enforcement, custody, and public health, the numbers of individuals who have received vaccines, but I don't have a sense of what percentage that is without the denominator. Can you tell me that? Are we at 50%, 80%, 90% of each of those populations?
We don't have that statistic right now or that percentage, but I do want to make mention that I mistakenly gave the wrong number for the total number of employees vaccinated. It's actually 872.
Okay, but you know how many employees there are, so that would be able to quickly tell us what the percentage is.
794 have declined.
Sorry, 794, I didn't hear the end.
794 employees have declined the vaccine.
Have declined?
Mm-hmm.
Yeah, could you share this in writing for us in an off agenda with regard to each department, the enforcement staff, the custody staff, and the custody health? How many have received the vaccine? How many have declined it? And how many are left to approach? And I'm particularly concerned if the folks who are declining it are in custody.
Okay, Supervisor Ellenberg, Dalia Rodriguez, Assistant Sheriff. I'm just going to clarify really quick because I think that I can clarify a little bit the numbers.
Okay.
So total employees, we have 1,847. That's total number of employees. 793 employees have declined to take the vaccine, and I'll touch a little bit on that a little bit later. And we have 861 employees who were completely vaccinated with the first dose.
Okay.
We currently have 223 employees that are outstanding, which basically mean that they did not qualify to get the vaccine, or who we aren't able to locate their QR code, because the way that we're tracking the vaccine right now is with QR codes. So we're still working on some of those numbers.
Okay, so I have a couple questions about that. The 223 that are outstanding, why would any workers in this category be not qualified if they're in the same jobs and classifications as those who are?
Because we're also counting individuals that are working within the sheriff's office that are not in the custody setting.
Okay, got it.
Yeah.
And of the, are all of these numbers just about custody or custody and enforcement?
These are both custody and enforcement.
Okay, so of the 793 that have declined, which I have to say is just a mind-boggling number, how many of them are in custody, and have they been reassigned if they have declined to be vaccinated?
That is, we don't have the specific number the ones that are in custody. They are not reassigned.
Yeah, let me, I'm sorry to interrupt. AS Rodriguez oversees the vaccination components, but I'm going to jump in on the custody portion of this. I would have to estimate about of the 700 number, about 400 roughly are in custody. And although there was some previous information put out there regarding next steps to those who refuse, taking them out of the custody environment was not a part of it. So what we did was we said, if they're going to refuse, then they need to wear N95s. But the removing them from the custody environment was when they refused to test. Vaccinations are not mandatory, so therefore their refusal is expected. Like, we have an expectation that we're going to have some refusal. So we have to compartmentalize the vaccination process of a mandatory process and us being able to remove them from the workplace should they refuse, but we don't have that same ability with vaccinations.
So we are really hampered in our ability to limit outbreaks in the jail if the custody folks, and nobody's wearing their mask 24/7 or even through the entire length of their shift. We can't, I am a little bit speechless. We can't significantly reduce or eliminate outbreaks in the jail if every day we have people coming into the jail who haven't been vaccinated.
So there's different reasons, Supervisor. There's different reasons why we have custody deputies that are not being vaccinated. Some of them are reasons, for example, obviously we can't ask because of HIPAA laws prevent us from asking why, but there are medical reasons why some of the custody deputies are not getting vaccinated. We also have some custody deputies who are working at midnight shifts or that work weekends, and the clinics are not open during those times. So we have asked in the past if we could do a mobile vaccination process to get our staff vaccinated, because specifically the ones that are working like D team or C team, I believe, are the ones that are working midnight. So it's a little bit difficult for them to take the time to go get their vaccination. And then the other reason is we also have people that are off for various reasons that are unable to receive the vaccine.
So if it's a time issue, that should be the easiest and most expedient to address. They need to be able to get their vaccines at the beginning or at the end of their shift when they're there. And I'm sure we can figure out how to get vaccinators there at the appropriate time. Our county is spending money and significant people and communication power to exhort everyone in the county to have a vaccination, and the numbers are really concerning to me. And I want to direct a question either to Dr. Smith or to County Council. What prevents us from requiring vaccinations, except in some documented medical reason why it's unsafe?
I think I'll let Kavita answer that one.
I'm sure Kavita is delighted.
If she doesn't want to, I'll try.
Sorry, I was double muted. I'm muted both on my computer and on my phone. Hopefully I'm audible now. I'm not aware of any legal requirement that would prevent the county from requiring appropriate staff to vaccinate, but I can't say that I have done focused legal research on that issue, and I don't want to speak out of turn on something that's so important.
If you could then send an off agenda to the board, because I think it is worth pursuing an answer to that question, because it really is counter to the message that we are trying to extend to our 2 million residents across the county. And further, I think it's worthwhile for the Sheriff's Department and Public Health to dig a little deeper into the refusals. Perhaps more education is needed, perhaps a town hall with our custody employees and public health so that they can ask questions that may be concerning them. We can address the logistic issue, I would hope, immediately. But I would like, within the next couple of weeks, to hear some advancement of some very proactive education, collaboration, communication, whatever we want to call it, plan to get more of these folks to accept the vaccinations if in fact we can't require them.
Understood, and I understand that legal research has begun within my office, so I just noted the request for a memo, and we'll make sure that we follow up on that.
Fantastic, thank you so much. Just one last question for this. Can somebody confirm from the Sheriff's Office how often and by what mechanism inmates can request new masks, and what type of masks do they wear?
Sure.
So the type of mask currently is cloth, unless they're high risk, at which time they could be issued an N95, but that would be more in a medical environment. Day to day, they're cloth masks. I know that we've been working on a committee to research a higher grade cloth mask where inmates will not be wearing the paper surgical masks, but will still have equivalent protection. That's ongoing, but at this time, it's in general, it's a cloth mask.
So first of all, I think they should have this, they should be entitled to the same protection as the staff, particularly if staff members are refusing to be vaccinated. If we want staff to be in N95 masks, unvaccinated inmates should be in those very same masks, because we're acknowledging this higher risk of spread. And also the second part of my question that I didn't have an answer to is how often and how do they request replacements?
Yeah. So they get masks upon intake. There are numerous ways in which they can request masks, replacements or otherwise. If they show up to an area such as, say, transportation, because they're going to go to court, they're issued a mask there. The workstations have masks for replacement on demand. The most standard communication we've had with those incarcerated is to request either by way of request form or to medical, which medical comes to each housing area several times daily. They can get them also from medical staff. Medical staff, nurses actually sign out masks and bring them to the housing areas with them. So there are multiple ways that they can get masks, replacement or otherwise.
Okay, thank you. I'll finish there with just a closing statement that for the thousands of people that remain in our custody, it is incumbent on us to protect them and keep them safe. And to the extent that staff is not contributing to their safety by refusing to be vaccinated, we need to take additional steps to protect the people that don't have a choice about exposure. Supervisor Wasserman.
Thank you, Madam Chair. I'm intrigued about this discussion about what I heard was approximately 200 correctional officers. Is that right? And I'm addressing this to the sheriff's group.
Thank you, Supervisor Wasserman. It's Dalia Rodriguez again. That is correct. There's 223 that are outstanding again, and that could be a variety of reasons. And
Okay,
just
so
one more, sorry.
No problem. So we just rounded off to a couple of hundred. That's fine. What I'm intrigued about is I know people, we have the ability to bring a mobile unit there, so that's an option. If a person works an 8-hour shift and sleeps an 8-hour shift, they've got 8 hours off where they can go to any county facility and get vaccinated. So out of the 220 people that are not, except for those for medical reasons, as you said, there are a small population of those individuals, is there any physical reason that you think they can't get vaccinated? And how many out of the 220 would you say have a medical reason that they cannot?
If I may, Supervisor. So the other reason is because we've had 226 custody deputies, or staff members, I should say, that have tested positive. A lot of them have advised that their doctors are advising them not to take the vaccine if they've been positive in the last X number of days. So that's another reason why we have a lot of people declining, not refusing, but declining to take the vaccine.
So you have 50 or 100 people that have had COVID in the last few weeks and their doctors say, wait 30 days. Can you help me understand that a little bit more? This is the first I've heard of this. It's the first I've heard of any individual saying their doctor said not to get the vaccine. We've had our Dr. Cody and the other doctors say you can't get COVID from the vaccine. It's physically impossible. But is there a large percentage of people that had COVID recently that have been told by their doctors, to your knowledge, not to get it?
To my knowledge, is from the information that we have, is there are several people that have advised that their doctor have told them not to take the vaccine if they have had COVID within 90 days. That's what the information that we're receiving. I don't have exact numbers because, again, some of that information is HIPAA related and we really can't request staff to provide us complete reasonings as to why they are declining to take the vaccine at this time.
Okay, perhaps along with Supervisor Ellenberg's other suggestions, perhaps there's some information that our public health department, or maybe I'd sure like to get some information of those doctors. But be that as it may, would you say 50% of the people have had COVID in the last 90 days that have chosen not to be vaccinated at this time?
I'm sorry, Supervisor, we just don't have those numbers in front of us.
Okay.
I just don't have the ability to confirm the numbers right now.
Okay. Would you say 25% of the people can get the vaccine but have refused to do so?
I would say maybe 25% of the staff members have the ability to take the vaccine, but have declined to do so at this time.
Okay, so that would be about 60 people, 55 people. I guess it's the other 150 that I want to make it as easy as possible for them. Dr. Smith, please correct me, but they could go to any county facility. They would need an appointment, I assume. Or what about the likelihood, Dr. Smith, or if Dr. Marty is on, about a mobile unit going to the facility and having people receive their shots at that time, whether they're on duty at that time or off? Is that a possibility? It seems like it's the problem we should be able to resolve fairly simply.
Supervisor, we set up a special access program at the fairgrounds where we had police, or fire, I should say, paramedics setting up ability to funnel the correctional officers through that system so that they didn't have to go through the standard appointment process. They could go to the standard appointment process. There's nothing preventing them, but we have had the special access way to get vaccinated. In terms of going into the jail, that poses a more significant problem. Mobile access is a possibility, but again, right now, I think the main issue is people are refusing the vaccine. So it's not that there's not access, there is access.
Okay, and I guess another alternative, and I'll end with this, Chair Ellenberg. If we knew of 20 or 30 people in a given shift on any given day that wanted the vaccine and hadn't had it, I guess we could deliver a couple of dozen doses to the medical staff at the jail to give them in-house.
That's possible to do if there's interest in getting vaccinated. It poses logistic problems just because the medical staff is, got other responsibilities, but it could be done.
Okay.
I think the main focus is not access, but willingness to get vaccinated.
Okay, well, I hope we can come up with some ways that the 150 out of the 220 that want to get vaccinated can get vaccinated soon, including those that their doctor said for whatever reason, don't get vaccinated within 90 days of having had COVID.
Yeah.
Yeah, is that something you've heard, Dr. Smith?
Yes, recommended at this point is that you wait 90 days after your COVID episode before you get vaccinated.
Got it. That makes sense then. Thank you very much, Madam Chair.
Thank you. Sylvia, I see your hand. I just want to confirm the numbers. Mike, it's actually been, so 223 are still outstanding, but 793 have already declined compared with 861 who have been vaccinated. So it is almost a 50-50, which would really suggest to me that this is some sort of a cultural issue, certainly more than access. Sylvia, go ahead, please.
Thank you very much. I just wanted to do a quick follow-up on the mask issue for the inmates. I was part of the webinar with the Dr. Smith and Dr. Cody just yesterday, and one of the conversation topics was double masking, and I recall Dr. Cody actually advocating for that and did a little visual demonstration in that webinar through the bridge for our county staff. And in light of our conversation, in light of the recent information that has come to our attention about the 793 people from the sheriff's office, some of whom will be custody staff that are refusing to vaccinate, it seems that we need to enhance our efforts to give the inmates not only the access to the masks as you have mentioned, but also if they require it and request it, the opportunity for double masking. And I know there's a lot of rules sometimes with custody inmates that can and cannot be done. And I just want some clarity that if we advise some of our clients to request to have the opportunity to use 2 masks instead of just 1, if there's going to be any issues or problems in doing so.
Thank you. I want to just make sure, does anybody else want to speak, first of all? And Nancy, I'll ask you to help me if you see hands raised.
Yeah, I have a
don't.
Comment.
Go ahead.
Supervisor, if I may.
Please.
Yeah, we have our work cut out for us definitely regarding staff, and we're open to any new suggestions regarding those who are in custody. One of our greatest challenges today is actually getting the inmates to wear masks. I mean, we don't want to discipline them per se and take away a lot of liberties that they're already restricted. I mean, with visiting and everything else, But the irony is as I've done my own audit and I've gone through many housing units, one housing unit after another, I had found 2 staff members who had their mask on their chin. There were no other people around them, but we'll carry out corrective action on those individuals. I also found one IDO attorney who actually completely removed a mask and had physical contact to a limited degree with the inmate, her client. I mean, we're talking social distancing, we're talking mask wearing. So we're doing our best. We also have a lot of other challenges that we're working through. So we'll continue to move down that, but I'm working with my captains on putting together a regimented auditing system, even though we already review, to where we can get a true capture of civilians sworn and visitors who are and are not in compliance. Thank you.
Yeah, some of that is a little bit at odds with public health's most recent walkthrough, never identified inmates who weren't wearing masks. So the inconsistent information is concerning, and I want to make sure that we're clear before we close this item, and I appreciate everyone's patience with the length of this back and forth, that we are going to look for from County Council some advice on whether we can require vaccinations. We're going to look to the Sheriff's Office in partnership with administration and or public health to come up with some sort of program plan, educational effort to increase the percentage of staff members who will accept vaccination, to understand a little bit better the refusals. Was there a third piece, Mike?
No, I
other information back. Oh, the breakdown. No, I think we've got that now. I think those are the 2 things.
What I'm hoping, Madam Chair, with your 700 or 800 number,
yes,
where you were saying refused, I'm hoping at least 25% of those people are under doctor's orders that Dr. Smith just confirmed, that you don't get a vaccine within 90 days of having been positive. Because I'm sure we've had a few hundred men and women in the jails, the officers that have contracted COVID that are within that 90 days now. So it's not that they're refusing to be vaccinated. They've been advised not to be vaccinated.
Then we need to add to the request a tracking system so that we know when people's 90 days have expired and can then determine whether they are willing to get vaccinated. We clearly have to watch this very carefully and have to track people. This is the definition of significant public health risk. And I think we can't be cavalier or casual about it, and we can't shrug and say, well, they don't want to get vaccinated. It's not for us to determine, and I believe that it is for us to determine when they are in direct contact with people over whom we have direct responsibility, and that's everyone in our custody in the county. Martha, is all of that clear to, yes, Supervisor Wasserman?
And thank you, Madam Chair, for that. What I wasn't clear on with the various back and forth between the individuals was, out of the 700 or 800 number that you said, had not been vaccinated, how many of them had refused to be vaccinated?
No, there are 2 different numbers, Mike. 223 are outstanding. 793 have declined. 861 have been vaccinated.
Okay,
3 different categories. So nearly 800 people have said no, thank you.
I understand that, but I'm just saying, perhaps, and I have no idea, 600 of those 800 are told by their doctor.
Oh, I understand. That's why I asked for the tracker, so that we can find out when they're at the end of their 90 days, do they get vaccinated? Is that actually the reason? And if it is, then we should see our numbers increase as people get further from their time.
I just didn't want a story to get out there and run that 800 of the 1,600 have refused to get vaccinated.
But that is the case.
But I don't think you can call somebody, I don't think you can say that someone has refused to get vaccinated when their doctor said don't get vaccinated.
Okay, that's fair enough. So let's get that breakdown so we can be clear. Martha, got all that?
Okay, with that, we'll go ahead. We'll move to custody health. Dr. Day?
Excuse me, through the chair, while we wait, I do see that Sheriff Lori Smith has her hand raised.
Okay, and I'm happy to come back, but actually what I'd like to do, Martha, is take the custody health services verbal report under item 5 with the rest of that department's quarterly update, because the quarterly update focuses on COVID as well. So let's hold that and go to the sheriff, please.
Thank you. You know, I think the first fundamental question that we ask is, can we mandate? And because we have not mandated it, we've offered it. So they're not refusals, they're declines. A lot of those are civilian personnel that don't work in the jails. And so we can refine the numbers further. But the question is, can we mandate the vaccination? And that's really a fundamental thing. Pregnancy is also another reason that they're advised not to get the vaccine. So there's any host of reasons. And we can certainly refine the numbers more. But the fundamental question is, can we require? And if not, what can we do?
Mm-hmm.
Thank you.
Thank you very much. And that did remind me what the last piece was of what we were asking for, is that breakdown amongst the 793 who declined. How does that break down so that we can, and going forward, when people decline, we track the reason. If it's the COVID and the 90-day rule, we track them to the end of that 90-day. And in the meantime, when we work with public health to create whatever kind of education access or opportunity for those people who have declined, not for medical reasons, to get those numbers up. I think that's just critically important. Molly, did you want to say something, or you just turned your camera on?
Waiting my turn. Thank you.
Okay. Okay, Martha, with the wait on custody health, who's next?
We will go with Public Defender O'Neill. Thank you.
Hence my camera being on. Thank you, and good afternoon, Supervisor Ellenberg and Supervisor Wasserman. A few things. I would revert back to our district attorney's comments about our call with Dr. Cody this week. But before I do that, I'd like to mention that some of that call was about getting the frontline public defender and district attorney lawyers and paralegals from our office who are in court vaccinated. And we could do all of that with about a third of the vaccines that have been refused by the Department of Corrections staff. It was a productive call with Dr. Cody. It was just the three of us, about a half an hour. And one of the things that I provided to Dr. Cody was a list of some of the counties across California that have classified public defenders and DAs in different tiers. So for example, counties who have placed those lawyers in tier 1B include Alameda, Santa Barbara, Siskiyou, Nevada, Humboldt, Kern, Napa, Imperial, and Stanislaus. I believe under the emergency services category of that classification. So I really do think part of the problem is that the state has not provided very good guidelines in terms of who fits into what category. But I believe that, there's some discrepancy because civilian staff, for example, in the Department of Corrections and some civilian staff in the probation department as well have been vaccinated at the same time that we're not getting vaccinated. But as you look at the chain that was involved in the last 30 minutes of discussion, you have correctional officers who are declining vaccines, who have hands-on with incarcerated individuals. You have incarcerated individuals with
without double masks and with cloth masks, which are certainly not as effective as N95s or KN95s. And in that chain then comes along our staff who are in court talking 6 inches away from the very same people we're talking about who are not masked and are being exposed to people in the jails who are declining vaccines. So we're not asking for all our entire staff, but we did have a productive conversation with Dr. Cody. I did share this information, and I'm hopeful that as we move forward and more vaccines become available in the next several weeks, will be included. And we are happy to be put on a list where we show up in the event that people have canceled, at least for our frontline workers. So thank you for the time, and we do hope to get vaccinated. Thank you.
You're mute, madam.
Yes, thank you. To either, I don't know who's appropriate to respond to that, Martha, Dr. Smith, is there any further work to be done there? What is the status? Have the public defenders and district attorneys been given a concrete answer as to whether we can include them in the 1B?
At this point, we're still trying to follow up with the state to get clarity. They're supposed to be giving us something in the next few days, but that's been true for the last week or 2 weeks. I know I'm aware of the meeting that they had with Dr. Cody. I didn't specifically discuss the substance of the meeting. So I'll have to follow up with Dr. Cody and find out what happened, what the plan was. But I know that there's lots of confusion at the state level about who qualifies and what. There's part of the discussion at the state level has suggested that they're going to go strictly to an age-based allocation system.
That's after the 1B, though. We're talking about including them in the 1B, and I would recommend reaching out to your colleagues, Dr. Smith, at the counties that Molly mentioned, to see how they did it. And we certainly have had our own moments of being bold and out in front and making our own interpretations as to what state rules mean when they are less than clear. So I would certainly feel confident that we could make a determination in this case that's consistent with at least 10 other counties. And I do think it's important for the public defenders and ADAs to get clarity on this. I'm sure that it's an additional constant stressor or source of anxiety for them, still not knowing what their status is and still having to put themselves at heightened risk every day.
Right. Will do.
Okay, thank you. And will you send an off-agenda update to the board as to what you learned from your colleagues and from the state, and where our council thinks that we can safely go with this?
Sure will.
Thank you very much. Are there any other comments or questions on this item? Sub-item? All right, back to you, Martha.
With that, we'll go to the Independent Defense Counsel's office. Celia?
Thank you very much. Just very briefly, I did sort of want to, I'm sure the board knows, I did make a very minimal request for the same sort of allocation, actually 60 or so. And so that's really our only concern and big issue at this time. Thank you.
I apologize for not calling out the IDD. I absolutely see all three bodies in the same category.
If there's no questions, we can go ahead and move on to probation. Chief Garnett.
Hi, good afternoon, Madam Chair, Supervisor Wasserman. I'm going to have Deputy Chief Nick Burchard update you on the COVID situation, and happy to answer any questions after.
Good afternoon, Supervisor Ellenberg, Supervisor Wasserman. Probably the most notable change that was mentioned somewhere about 30 minutes ago in this discussion with the jails is the visiting. That will now take place again, both at our juvenile hall and our James Ranch, based upon us moving out of the purple code. So we're hoping to start that. And in fact, I know we're starting that this weekend and then next Wednesday, both in juvenile hall. That's probably the most notable change. Currently, we have 4 staff that are positive between juvenile hall and the James Ranch. And we have 0 kids positive right now. That's my update.
That's great. What's the status of, I know that probation staff are eligible for vaccination. Can you tell us what the status is there?
Yeah, it's not a whole lot different than what the sheriff's has presented. We probably have 50% of our sworn staff who have been vaccinated through the first round, 60% of our probation officers, and 41% of our custody health staff, both at juvenile hall and the James Ranch.
And of those, Nick, who haven't been vaccinated, have the opportunities been made available and they've declined, or it hasn't come to their turns yet?
It's very similar to what the sheriff's mentioned. I would imagine that anywhere from 10 to 15% would be those folks who maybe received their first vaccination and became COVID positive and now feel like they can't get their shot pending that, as Dr. Smith mentioned, 90-day waiting period.
Okay. Mm-hmm.
There's also those staff whose doctors who told them that they don't recommend it. And then there's those staff who just have vaccine anxiety and choose not to get vaccinated.
You know, as I want all of these folks in custody and probation to get vaccinated, but if they are declining their vaccines and we have public defenders and ADAs and independent defenders who are practically begging us, it would seem more than equitable to divert vaccinations. Well, I'd rather not divert, I'd rather have more supply, but if they're being turned down there, let's give them to the folks that are asking for them and that are literally in physically the same environments. It's been just an upsetting and frustrating meeting to hear the extent of our employees who are declining this opportunity when there are so many people who are desperate for them.
And I think that will be answered through County Council and Dr. Smith and the question you raised about mandatory vaccinations.
Yeah, thanks, Nick. Mike, Supervisor Wasserman.
Thank you, Supervisor Ellenberg. This is a tough thing. This is a very, very tough issue. I learned earlier today that 81% of the people that have died from COVID in Santa Clara County were over 65 years of age. And we don't have enough vaccines to vaccinate everybody over 65 years of age. It's going to be weeks and weeks and weeks. Sure, there's going to be people in that group and older that choose not to, people we don't get to, whatever. But it is so tough. I mean, when I get emails from public defenders, when I get emails from priests, when I get emails from school teachers, my heart goes out to each and every one of them. But the reason this is so hard for me is that the odds are with the 30 and 40-year-old surviving, and the odds are against the 65 and above-year-old surviving. And just as you said a minute ago, Madam Chair, you know, the real problem is the lack of supply. The demand right now is 1 million people. So I appreciate and totally respect everything Nicholas and Sylvia and Molly and Jeff Rosen have said. But it's such, I mean, it's like right now there's only so much room in the lifeboat. And I have a hard time, as much as I appreciate all the department heads and all their people and the work that they do every day and the risk they put themselves at going to meet their clients in very close proximity without the ability to have an acrylic shield in front of them, without the ability to have 2 masks on, and saying, okay, should that 40-year-old or a 70-year-old get the vaccine? And I think it's something that what I'm saying, I believe many of you are thinking. It was tough. I almost didn't say anything because it's not, I know who I'm speaking to here. And these are people I work with, and these are people I respect and I appreciate. All of the above. We have to do a better job getting the 65 and over people vaccinated. There's a ton out there, and we have a few thousand vaccines, and we're scheduled to get 25 or 30,000 vaccines. But Dr. Marty already has things in place where he can do, we can expand with San Jose State and Levi Stadium. We can expand to 15, and we, just the county, I'm not talking Pamp or El Camino or Stanford or Kaiser, just the county could vaccinate 15,000 people a day. So the enemy right now is the lack of supply. That's our common enemy. Every one of the 25 people I see on my screen, and I see we have 57 participating. You know, it's not the women and children first in the lifeboat kind of a thing. It's we are ready. Santa Clara County is ready to vaccinate as many people as needed. We need the vaccines. And I wish all of you could get the vaccines tomorrow. I just needed to put that out there because that number I heard this morning was from Dr. Cody. I had no idea that 81% of the people that have died have been 65 and above. Thank you.
Thank you. Because we are diving into this direction, I see you, Molly, and I'll come to you in just a second. I'm going to push a little bit there too. Yes, those are the numbers of people that are dying. I'm not contesting the science, but I'm also not minimizing the attendant risks of getting ill and possibly losing your job, working in a grocery store. In comparing a 66-year-old retiree who can safely stay at home versus a 35-year-old public defendant or a 29-year-old grocery worker, we don't know the long-term impacts. Not being dead is awesome, but being sick for a long time, having lasting impacts, we just don't know enough right now. And I know certainly, Supervisor, you're not being cavalier about younger people, but I think that it is critical that we consider the risk that people have based on their jobs every day. There's a strong equity component there. This, in my view, should not be about age alone. And I know that we're arguing with things that are somewhat out of our control. So I want to kind of put a bow on it and move on. But I think we definitely have some very respectful and polite differences there, which is where we are. Molly. Oh, I'm sorry.
Yeah, I'm by no means minimizing, you know, there's children that have died. There's people with long-term, there's all those things. What I do know is that the state is evaluating us based on our hospitalization ICU beds and the number of people that die. And the science says that if older people get COVID, they're more likely to be hospitalized than if younger people get COVID. And if the state's going to withhold our ability to open up our economy, if, you know, do all the other things that COVID is causing, because of our ICU bed usage being below 15%, or our number of people dying, then I think it's pretty darn prudent to limit our hospitalizations, because very few people die without having been hospitalized first. And that's the only point I was trying to make, Supervisor Ellenberg.
I hear you.
Yeah, we each respect the members in each place, but it's not just that. It's the state controlling us. I know you and I are opposed to that.
Got it. Molly.
I'll be very brief. Supervisor Ellenberg, you essentially made the point I wanted to make, but A, I really appreciate the supply problem, and B, I particularly this week appreciate the elderly problem. My mom's 87. I finally got an appointment for her Sunday morning, so I'm gonna get her there to get vaccinated. But I think the distinction between those in an age category who are not working and are able to stay home and younger lawyers in my office who by and large are 60 and younger, is that those folks have to come to work. They have to be in court. They're the same as the Department of Corrections staff and probation staff who've already been prioritized to be vaccinated. There really is no difference in terms of the requirement that they be at work and be in court. And it's 150 people or so between our two offices. So it's a very, very small number. And Sylvia had a lawyer who very early on in the pandemic was in a coma. He's a younger guy in a coma for about a month. And we don't know those long-lasting, long-term effects yet. So I think that's an important distinction as we make these difficult decisions. And I still am very hopeful that we'll find a way to get that subpopulation of our staffs in the IDO and the DA's office and the public defender's office vaccinated sooner rather than later. So thank you.
Thank you. To anyone who joined us late, this is not a committee meeting of Health and Hospital, but it has become hard to tell. I think that was the last report, Martha, is that correct?
We have reentry and pretrial.
Oh, my apologies. I'm sorry.
So with that, we'll go ahead and move to reentry, Javier.
Of course.
Yes.
Apologies, Javier.
Good afternoon. Just a brief update. So we're still averaging about 41 clients at the reentry center here in San Jose. And in the month of December, we had a huge increase of calls, 64% increase from the last month. So a lot of people have been calling us for information. And then I just want to remind everyone that we are open on Tuesdays and Thursdays from 5 p.m. to 8 p.m. So we have evening hours, and then the first Saturday of the month. So we'll, the first Saturday of the month from 8 a.m. to 12 p.m. So we'll be doing some advertising in our community and our stakeholders. And lastly, we had a really good meeting with the Sheriff's program staff to identify when some of our providers will be able to go to do virtual remote classes, presentations. And so we're looking at mid-February, where in addition, about 5 additional providers will be able to join Goodwill and Carry the Vision, who are already doing classes and presentations in custody. So we're really excited about allowing our providers to do remote presentations. And that's my report. Thank you.
Thank you. Any questions? Molly, your hand is up. Is that for this, or is it still up from the previous?
I'm taking it down now.
Okay. Thanks, Martha.
Okay, with that, our last is pretrial services. Matt?
Yes, mine will be very brief. Good afternoon. I'd like to thank the Sheriff's Department and Custody Health for helping to keep pretrial and admin booking staff healthy and productive. Some time back, the Sheriff's Department was kind enough to very promptly enclose the OR station where we interview people with plexiglass. That's been very helpful. And Custody Health has been great with the testing. Actually, the vast majority of admin booking staff and pretrial have now been vaccinated and will continue with the testing. So I want to thank the Sheriff's Department for that wonderful coordination. And glad to report that all services are up and running for pretrial except for drug testing. We're not drug testing at this time. And we are innovating. You'll see some services that we're going to be piloting with the Public Defender's Office and the DA over the next couple of weeks, since we know that we're going to be in this setting for a while. Thank you.
Thank you.
No questions.
No questions? All right. Do we have public comment on item 4?
Yes, we have 2 members of the public that wish to speak.
Okay, let's do 2 minutes each, please.
First speaker is Scott Largent. I'm unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, everyone. Scott Largent. It sounds like the Titanic, and only a certain amount of lifeboats, only a certain amount of people are going to really make it out of this disaster. There's a lot of people in a lot of different departments that are opting out of getting the vaccine. So this is not just a sheriff's department thing and a probation department. I've heard a lot of chatter. I've talked with people personally. So, and I understand the concerns, and at least some of that stuff was brought up, and maybe we need to do a little more research before we make big decisions and kind of jump the gun on things. Another thing, when I go to the courthouse, because I've been continually trying to get into the clerk's office, and of course it's been shut down. The first line of defense at the courthouse is the sheriff's department. Then, of course, we have the public defenders. They kind of have 2 tables set up. So they're right out there in the front. But it is 3 to 4 sheriff's deputies that have to interact with everybody that's coming to the Hall of Justice. And people are riled up. I even get riled up. You guys know that. I need to get into the courtroom. I need to do this, blah, blah, blah. And they handle it pretty well. The ones that I have spoken with in front did not receive a vaccination. And this was 2 or 3 weeks ago. I thought that was kind of shocking because they are right out there in the front. Recently, also at our civil courthouse, when there was some protesting going on, and I thought this was really weird too, the first line of defense, of course, is the sheriff's department. And they've got to be out there holding that line as they're being spit on, swung at, basically assaulted. I guess what I'm trying to get at right here is we need to hold those people accountable, and that could have been a super spreading protest. So we need our DA to do the proper thing and file charges. That's assault, it's a battery, and a whole list of other things. Especially seeing deputies get swung on and actually hit is just inappropriate. And okay, thank you.
Our next speaker is Cynthia Longs. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking. Cynthia, can you unmute yourself, please?
Yes, I'm interested in speaking on number 5. My son is in custody, Maine jail. Do I speak now? I've been waiting for a while, raising and lowering my hand. Is this the time for that now? Or should I wait to the next?
Why don't you go ahead?
Okay, yes, I'm here because my son is in the Maine jail. I am a member of DBUG. They've helped me tremendously as we're trying to figure out the situation. My son has been detained because of COVID-19, and therefore we haven't been able to have court. I've gone to visit him several times, but before visiting him, my son has asthma, and it was very difficult to try and get him to get the services he needs to get, a refill on his asthma medicine. But once we got through and we had to call the nurse, we got through to that. But now he's having problems getting a new mask. When I was able to visit him, it was obvious that the mask was always dirty, and I would always tell him what you need to do is you go and you ask for the mask. You try to get what you need because you know you are susceptible to this disease of coronavirus being inside. Also, my concern is about the dirtiness and how nasty it is there. Whenever I visit him, the waiting area sometimes don't always have the hand sanitizer nor the gloves for me. I have a new kidney, and therefore I am at risk. I have to visit my son, and I take my grandson with me. When we go up the elevator, sometimes they do not want, the guards prefer to put many of us in the elevator together, and I insist, and I let them know my situation. I try not to be so vocal about it, but they're really nice about that. But when we get upstairs, it is just so nasty, and I don't understand why there's no janitorial service or anything. And so you can imagine if it's dirty on our side, we have to clean our own counters, etc. And it's also dirty. So they have the hand sanitizer there for us to clean. But what we need to do is, I don't understand why there's no kind of service or no cleanliness inside for even us once we're trying to get to see them. So I can't imagine, like I said, that it's bad there. And when it comes to the mask, I don't think anything has changed. He has not been able to get a new mask as often as he'd like to get one, and he has the paper mask. I thank you for your time. And there's other things I've left out, but thank you very much.
The next speaker is Irvish. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much. I wanted to let the Public Safety and Justice Committee know about the ongoing system and how the ongoing system change, would help enable different people within the County of Santa Clara as well as district to help out with it. Though the County of Santa Clara and the County of Sheriff's Department had a different services established, but on so many occasions, the timings to reach out to the right set of people, as well as accumulating the resources and allowing the citizens to speak in right term of a manner. Sometimes it's becoming difficult to get to all the resources that requires to establish the contact and as well as to verify the information. I request the Public Safety and Justice Committee to establish the right set of resources so that people would be able to know that what it takes to know the public safety and justice system is within the county of Santa Clara. What are the different court services are available? How those court services could be enabled so that they would be able to help them out and understand that what resources are required and what is the process that they have to go through in case of a public safety and as well as the justice the court justice system they have to go through. Also, it is important to evaluate that how the different roles, regulations, and different holders within the system enable them to know that how the system is working and how they would be able to get the information in order to get to the right set of resources, even though whether they are being at the fault or not. So getting the right set, getting the safety and the right set of and the justice for them, it's very important. So I request the Public Safety and Justice Committee to enable those services and to guide them to the right set of resources. Thank you.
And that concludes our public comment.
Thank you very much. I believe we don't need a motion on item number 4. That was all informational. So we'll move to item number 5, which is to receive a quarterly report, quarterly update from Custody Health.
Okay. Good afternoon, Supervisor Ellenberg and Supervisor Supervisor Wasserman. Sorry about that.
No problem.
Okay, and this report is from October the 15th through January the 15th, and I'll just give a couple of highlights. Similar to my custody colleagues, we have begun rapid antigen testing daily. What this is basically a test that we are administering daily to all custody health staff and all custody bureau. And the test gives results in about 15 minutes. And if it proves positive, then we do the PCR nasal swab. Of that, we've had about 10 staff come back positive with the antigen now, Binax now testing. And then the PCR actually also came back positive with that. And so that's been a heroic lift. We're put through about 700 staff a day. We've had to reorganize several different times just because of space and to make sure that all folks had access to the testing. We also are wearing all N95 masks. And so this is another thing that we have put forward. The Binax testing now is mandatory. And the N95 also, we are highly encouraging those be worn by all healthcare staff as well. And so that has been positive. We also are working quite closely with our patients. We have done quite a bit of patient education. We have done video streaming in the housing areas in 3 different languages for the patients around testing, trying to encourage them to test. We also are offering some incentives. We try to sort of query the patients to see what would motivate them to test more frequently. And one of the things that came up was, stamped envelopes. And so we have been giving stamped envelopes right behind a patient agreeing to test. And so that has been pretty successful. And so that's my report. Those are most of the highlights. As you know, we've had a surge in our COVID-19 positive patients. Those were anticipated behind Thanksgiving, Christmas, and New Year. And so we have been very aggressive, not only with the rapid testing, but very aggressive in wrapping around that. We peaked on January the 3rd with about 115 new cases in one day. And then we had another peak on January the 5th with another 43 cases in one day. And as the custody colleagues have mentioned, we are 9 positives today, 7 confirmed cases in-house, and we do have 2 patients that are hospitalized. And so that's pretty aggressive in our approach to COVID-19 in the jails, as well as with our staff. And I'll take any questions you might have.
Supervisor Wasserman.
Thank you. I just wanted to say what an overall great job, Dr. Day, you've done. I know you've had the surges. We've all had the surges after Thanksgiving and Christmas and New Year's. And I'm really hoping the Super Bowl fans don't cause another surge. But after that, I think we're down to Valentine's. So thank you very, very much with your efforts overall, and you're really being on top of things. Thank you.
Very good. Thank you.
Thank you. Dr. Day, I really appreciate as well the comprehensive report on the department's COVID response. But I think our wires keep getting crossed regarding the expectations for this quarterly report. I think we've discussed or with our respective staffs that this report is really meant as an opportunity for Custody Health to provide us with background on the overall work of the department, issues relating to staffing and programs, consent decree implementation, new projects, and initiatives, essentially everything that isn't COVID response. So going forward, what I'd like to do is keep all COVID discussions and updates under item 4 in the verbal reports. And so let me maybe turn to Dr. Smith. Maybe the board requested an off-agenda report on the status of conditions within the jail during the last outbreak, particularly in response made during the hunger strike. Do you know when we can expect that report?
Yeah, that's coming, but it's not coming from Custody Health specifically. It's coming
right. That's why I turned to you.
Right, and it should be within the next week.
Okay, thanks. I realized halfway through my question that it was not to Custody Health.
Yeah.
So just wanted to make that clarification with you, Dr. Day. And if there are any ongoing questions, happy to have my office work with yours as well. I know you've got quite a big plate.
And Supervisor, that was a misunderstanding on my team's part. So it's duly noted, and on the go forward basis, you'll get those other reports.
Thank you so much. I really appreciate it. Do we have other comments from anyone on our virtual dais? Do we have public speakers on this item?
We have one speaker wishing.
Okay, 2 minutes, please.
And our speaker is Tina Brown. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Tina Brown. I am a system impacted family member with a son inside the main jail. I am in full support of Silicon Valley DBUG, families and their loved ones incarcerated in Santa Clara County jails, and their recommendations in response to COVID outbreaks and the hunger strike in the jail sent to the board titled Written Comment Regarding COVID in the Jails. The Sheriff's Department and Custody Health state that they protect the health and safety of those in their custody, but they continue to directly violate their basic human rights by subjecting them to unsafe and unsanitary conditions, even during a deadly pandemic. Finding out that your loved one is sick to the negligence of custody staff is not only upsetting, but again questions their ability to do their job and what they get paid for. Today, I'm asking the Board of Supervisors and all committee partners to hold them accountable, as well as recommend the importance of oversight, outside oversight. Thank you.
Our next speaker is Irvish. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. I request the Public Safety and Justice Committee to reevaluate the condition under the COVID-19, reevaluate also that how the county of sheriff's departments are operating under COVID-19 situation, reevaluate the entire system that is working under the condition, how the different people going through the process, and as well as verifying their behavior, verifying their health status under the COVID-19. It is understandable that every citizen of a county of Santa Clara, as well as the district and the respective cities, are of a different kind. But it is important that when it is important to understand that when one person or different person being at the same place and also, getting either way, getting in touch with each other through the contact, either by a social gathering or by any or by any process, that they are going through the juvenile system. It is important that they also, go through the COVID-19 testing by by implementing the measures for the sanitation, as well as, cleanliness of our environment within the jail, the county jails, as well as city jails. It's becoming more and more important on a day-to-day basis. Preventing the COVID-19 is more important than ever now. I request the entire committee, Public Safety and Justice Committee, to reevaluate that, and also to implement the standards for the cleanliness, and as well as implement the provide the right set of resources as a part of vaccination within the every environment as well. Thank you very much.
Our next speaker is Jose Valle with Silicon Valley Debug. I am unmuting you. Please accept the unmute, and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello?
Hello?
Hi, okay. Hi, this is Jose Valle once again. So I just wanted to reiterate some of the recommendations that we went ahead and sent out a couple weeks back. I know some of them are sort of dated because there has been some changes, but I just wanted to reiterate to the best of my ability. So one of them is reinstating the Inmate Advisory Council meetings. The next one on the list, I believe, is to enforce stricter policies on correctional staff that do not follow guidelines. Number 3 is stop depending on the labor of inmate porters and enforce the biohazard and CET staff to ensure the cleanliness of all areas of jail life. And this is directly in response to the cells being filled with feces with individuals with COVID-19. The next one is provide new and clean face coverings free of charge daily, and provide other face covering options in the commissary. The last one, I believe, is have an updated reoccurring COVID in the jails report and audit from Oakland, the Sheriff, Custody Health, and other relevant parties, and meeting time to share information to the public and receive information as well. The last one, I know it's going to be pretty tough, something that we have all been frustrated with, but it's definitely the grievance system. And if it could be done by a third independent party, I think we could avoid a lot of different issues if we had a better grievance system. Thank you.
Our next speaker is Molly McLeod. I am unmuting you. Please accept the unmute, and you will have 2 minutes to speak. The timer will start when you begin speaking.
My name is Molly McLeod, and I am a resident of District 4. I really appreciated what Chair Ellenberg had raised questions about. What is the culture? For me, the one of the images that will always stay in my mind, and which I'd given made statements about at the Blue Ribbon Commission, was healthcare that was lacking for my son. But then also the time that I went for a visit in M8, you have to get in a van for the correctional officer to drive you over there. So I wonder, what's the capacity? How many visitors are actually getting in? Folks have been deprived of contact for so long, and we know that this is one of the most important elements, is to keep connected to communities. Seared in my mind will always be the attitude of the correctional officer who was acting as if he was on a zoo tour guide and pointing out the animals, referring to the birds that migrate, the skunks that were on the premises, and then pointing over to the minimum security incarcerated men in the stripes, and referring to them as animals. So, there's a reason why this body has had to have so many different times for the system to be looked at. And when there's still evasiveness about how many and who gets in, I mean, I really feel for the attorneys who have to try in 5 minutes get life and death information in a setting where they're being shushed and can't get closer. What kind of system is this, and who does it serve? What's the outcomes we're looking for? Thank you.
And that concludes our public comment.
Thank you very much. We can move then on to item 6 was approved on consent. So that takes us to item 7, which is to receive a report from Behavioral Health relating to the Community Mobile Response Project. And just before I turn it over to you for the report, I want to note that I think for most of our PSJC departments today, this will be their first opportunity to be able to provide input on a program that is very likely to serve many of their clients. So I encourage all of you to use the time as desired to ask questions about this exciting work that's going forward. And turning it to Sherry with that.
Great. Thank you, Chairperson Ellenberg and Supervisor Wasserman. Sherry Terrell with the Behavioral Health Services Department. And we thank you for this opportunity to share a presentation on our Community Mobile Response Project. We appreciate the fact that we've been providing updates at our Health and Hospital Committee and now have an opportunity to share this information with the Public Safety and Justice Committee. So at this time, I'm going to turn it over to Jan Morale. Jan is our Senior Manager with our Behavioral Health Services Department, and she's going to provide the presentation today. Thanks, Jan.
Thanks, Sherry, and good afternoon, Chairperson Ellenberg and Supervisor Wasserman. I'm Jan Morale. I'm a Program Manager 3, overseeing the systems initiatives for our department and providing you an overview of where we're at with the development of the new program. So this new program is currently being developed as an innovation project, part of the county's Mental Health Services Act programming, a project that was initially developed with the Behavioral Health Contractors Association of Santa Clara County. And through that, we've been working with them diligently in partnership to help bring this along and finalize, hopefully by March. So this is one of the innovative ideas that was endorsed by our Mental Health Services Act Stakeholder Leadership Committee members. And through planning input sessions we've held through the past few months, we're building upon that initial idea through our community planning process. The most recent activity was holding additional planning input session in December and last month that were open to the public. In total, we held about 13. And it was really to gather a diverse perspective on what this new program should look like. So we have participation from consumers and their family members, behavioral health clinicians, family members who have lost loved ones, just as involved, and the reentry community members, as well as our youth, specifically transitional age youth, ages 18 to 25. And our various ethnic communities, our Spanish-speaking community, Chinese, Filipino, Vietnamese, African-American, African ancestry community members. And what I'm about to show you is a slide that's also attached to the ledge file, but I'm going to pick out 3 slides to go over just now. So let me take and share my screen. Okay, hold on a sec. Bear with me. All right. Can you all see my slide?
Yep. Okay. Yes, we can see it, Jan.
All right, great. So this is the PowerPoint that we shared throughout our planning input session for consistency. We translated to Spanish for a Spanish-speaking community focus group, as well as for our Vietnamese Spanish-speaking focus group as well. What I'm going to do is jump to this slide right here, slide 4. Okay, so as part of our, program development, what we wanted to do is also inform the public about what we currently have in place. So we're not duplicating efforts, right? So here you see a pyramid where we have our current mobile programs. So at the very top is our psychiatric emergency response team. And as you can see, it's activated through our 911 system. A behavioral health clinician is paired with a law enforcement officer. Currently, we have one paired with the sheriff's office, and recruitment's underway for the other 2 sites. In the middle there is it provides more of an intermediate level of care, and it's activated through our behavioral health services call center. And the staff is comprised of behavioral health clinicians, licensed waiver clinicians, as well as our law enforcement officer. So the very bottom there is the one we're talking about today, right? So we're looking at developing this program that takes more of a community-based approach. When possible, having it be more of a preventative program where we minimize law enforcement involvement. And having it be very trusted program that people can access. I'm going to go ahead and jump on to slide 7. So these are the 5 innovative approaches that we've been sharing with our stakeholders. So through the planning input session, we come out and prepare them and say, this has been what we're trying to build upon. And as you think and share your input, please consider these 5 innovative approaches. So there's 5: family involvement, a real focus on prevention, accessible through a community trusted phone line, creating a trauma-informed vehicle, and having community collaborators. So for the first one, through our planning input session and even up to now, that has been expanded a little bit. So not only do we want to involve family, but it's really up to the client, right? If they want their family members involved, or even a loved one that may not be their family member. In addition, having this be more prevention focused, focusing on lower acuity situations, and being able to provide pre and post-crisis response. The one thing that was very consistent throughout the planning input session was having the follow-through, making sure that people are linked up to needed services at the end of the service. So connecting people was very important to our stakeholders. In addition, it's very important to create a phone line that's very trusted by the community. So again, reinforcing, minimizing law enforcement involvement. And our community members really have voiced the need to not have this be involved with 911 or 311, but creating something very new. And even with this one, people are, well, I'll go through it in the next slide. So, and the fourth one is around creating a vehicle that can readily go out, be able to have the equipment there to be able to serve the client. And then again, the last part, which is a key element, is having community collaborators in the 2 specific target areas to be able to provide that consistent, continuous feedback to allow for folks to provide input. Is the program working or not? Do we tweak it? And really launching in South County and San Jose. And the last slide I'll be sharing with you is around this. So what did we ask? We asked about the transport, we asked about the phone number, we asked about the call center, the triage, and the team composition. For the most part, people have gravitated towards the 3-digit number just because if you're in crisis, it's really hard to recall a 10-digit number. In addition, for the call center team, and also the CMR on-site field team that goes out when they're dispatched, they want somebody that's empathetic, have behavioral health training, part of their community, people that look like them, people that can relate to their situation. So having folks be part of the team with lived experience. With that, we're currently, this week, we conducted work group sessions with our CMR work group committee members, comprised of our SLC and BHCA membership. And we're really working towards finalizing the plan to be able to share with our stakeholder group next week and be able to hopefully post, aiming to post this plan document and program by the end of next week. And eventually with the aim to bring it back to the Board of Supervisors for approval by the end of March. So I'll stop here and open it up for questions.
Thank you so much for that report. My office has been just very excited about this effort and tracking it closely. I'll start with Supervisor Wasserman and then open to all of the departments for your questions, comments, and input.
Thank you. I'm looking at some of the bullet points, and to hear things like this at Public Safety and Justice, the new INN project, currently referred to as the CMR program, is a collaborative approach between BHSD and the BHCA of SCC with financial support from the county of SCC BOS. And that's unique lingo. You've got to be from the county or a different planet. That's for darn sure. But thank you for your hard work on this. And that's all I've got to say.
Thank you, Supervisor Wasserman.
Yeah, thank you, Supervisor.
Yep.
Do we have any feedback, questions, or comments from any of the departments or anyone sitting on our Zoom dais? You have just wowed us all into silence.
Yep. Good job.
All right. Do we have any public speakers?
Yes, we do.
All right, let's set it for 2 minutes, please.
Sure. Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. It sounds like in preparation for getting these reports together and kind of what behavioral health is rolling out, that we only involve the in-crew, the behavioral health board, your own people, and not really the community. I know you talk about a lot of life experience, but that's not the people that you're hiring there. I kind of have my own personal behavioral health outreach team. Okay, I just couldn't wait around for the county. And you guys know I'm out there doing that. I interact and talk with everybody, and I document how bad it truly is and what the county is not doing. We spent 4 years beating a dead horse with Tony Tolis running this program. We on the way out the door, I know what we do in Santa Clara County. We praise everybody. We put that big parachute on them. We tell them they did a fantastic job. We all know that was just a joke. We know none of that stuff rolled out. Many of you supervisors were absolutely pissed off, just railing on her at meetings. It went from health and hospitals to public safety meetings to supervisor meetings to, even Big Daddy Joe was laying into her. This is not acceptable. Seeing people in traffic butt naked, smoking meth, screaming and yelling, and nobody showing up is wrong. It's everywhere. We had a man, Todd, that basically has been going up and down heading for the last 4 or 5 days. He's had the paramedics, the police, the sheriff's department, county officials, the crime lab, the San Jose Police Department, Scott Largent, Steve Preminger, many other people from the community trying to help this man. And where was behavioral health? Not even there. Okay. This man had some serious problems. He was schizophrenic, bipolar. He's cerebral palsy. Just a list of everything. This is a failure. I'm going to keep saying it how I see it. Thank you.
Our next speaker is Alyssa Koff-Ginsburg. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon. I'm Elisa Koff-Ginsburg with the Behavioral Health Contractors Association. I just want to thank the department and share with the committee how wonderful it has been to collaborate on this project. We've received a lot of meaningful input from the focus groups that Jan was referring to. And while we succeeded in accomplishing getting this far in record time, the MHSA process, which is the funder, is one that can take quite a long time. So after the board approves it, hopefully in March, it goes to the state, and sometimes that can take many months. So I just want to plant the seed that we may be coming and asking for some initial funding to start things off if there's a delay in the state funding. Thank you.
Our next speaker is Don Taylor. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, supervisors. This is Don Taylor from Uplift Behavioral Services, and we provide the youth crisis response. And I've also been a part of the CMR work group. And I just want to put out echo a lot of what Elisa just shared, but I've been really impressed with the partnership with the department, and there's clearly a need in the community, and there's the innovation potential here is pretty impressive. The committee's done quite a bit with the community forums to really truly gather the feedback from the community. And this really addresses, focuses in a lot on the equity issues that are out there, while at the same time has the potential to really reduce some of the law enforcement calls that are having to be responded for these type of services. So it's really promising what's ahead, and again, appreciation of the department and the work that's being done. Thank you.
Our next speaker is Irvish. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Sure. Thank you very much. I wanted to let Public Safety and Justice Committee know about that. Implementing the public safety and justice within the real world system is different, and as well as implementing the public safety and justice within the space is different. There are two concepts that we are looking towards. When we see that we have to develop a system for the county. The county comprises of at least 6 to 7 cities that comprises of Mountain View, Sunnyvale, Santa Clara, Milpitas, San Jose, and the different district respective supervisors associated with the different districts. And then also, we have to look at the city perspective as well, as the city has a different regions, district, and the industrial zone as well. All the zones, all different zones, all from a city perspective requires the right set of environmental resources to be implemented under this, as per the public safety and justice system, as well as in the terms of a county. In the same way, the different districts require the right set of implementation to be done as a part of a city and as well as being a part of a county as well. In terms of a real world scenario, in terms of a space, both the concept differs from each other, as the law for the real world and law for the space differs from each other. So should be the case for the public safety and justice. To implement the public safety and justice for the space, it is important to know that how the space works, because in the real world we know that how the system is built and how the city and counties are built as per the district. But for the space, we really have to understand that what is that it takes to establish that, so people understand that how the system works in terms of a space as well, and developing the laws for the space as well. And so should be the justice system and safety.
Our next speaker is Robert Aguirre. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello, Robert Aguirre here. I'd like to talk a little bit about mental health and the issues that we have right here in our county. We have a large number of people that are walking around the streets, especially in the downtown area, that are in serious need of mental health help, and they're not getting any. We have people throughout the entire county that require mental health help, and they're not getting it. I know there was supposed to be a mobile health van that was going around to help people. I just met with the Valley Homeless Healthcare Program people to visit somebody. It's a great, wonderful program. I think it should be expanded so that we now are able to provide mental health to more and more people, and especially those in need. Then I'd also like to talk about a lot of the things that are going on that are not being addressed by the city or the county. And on the mental health issue, I want to talk about, there was a Vietnamese woman that was attacked yesterday coming out of a bank. She went across the street to a Vietnamese market and was mugged, and they stole her purse. She had over $1,000 in it that was taken. This is not a crime that's conducted by unhoused people. They jumped into a car and drove away. And I think that this is something that we should also be putting forth, that a lot of the crime that does occur in the city and in the county is not being conducted by unhoused people, even though that seems to be the popular opinion. We need to start a program to start educating people about the unhoused, that most of them are just the same as you and I, that they have no issues, no problems other than poverty. And that poverty is what has got them to their point of where they're having to live without a house. And we need to do more to do that, to deal with that. I understand there's more federal funds that are now available, and I think we should be taking advantage of any and all federal funding to help house our unhoused. It's a serious problem.
And that concludes our public comment.
Thank you very much. I just want to call out again how significant it is that this program is being presented here in front of the Public Safety and Justice Committee as we evolve our notions of what public safety means and gain deeper understanding of how much greater attention to people in crisis by treating them in that way as opposed to the way we treat crimes in progress, I think will go a very long way towards significant justice reform here in our community. So this, I don't want to underplay or bypass the significance of this report and the work that's being done. So thank you very much. That takes us to item 8. And I'm going to ask for...
Madam Chair, if I may, I'll just say I agree.
Yes, sir.
I agree with you as well on your comments about this item.
Thank you. I'm glad to hear that. I'm going to ask with regards to items 8 and 9, given the hour of the day, if the Sheriff's Office would be amenable to foregoing verbal presentations. We, of course, have the reports and have reviewed them in our agenda packets and going right to questions.
Good afternoon, Supervisor Ellenberg and Supervisor Wasserman and committee members. Absolutely, we would be happy to do that.
Terrific. Thank you so much. Then we'll begin with item 8, which is to receive a report from the Office of the Sheriff on quarterly inmate grievance trends. Supervisor Wasserman, I'll start with you. Do you have questions on this item?
Thank you. No, I don't on 8, but I do on 9, but you're handling them separately.
Yes, I'll do just 8 right now. Thank you.
Thank you.
Well, yeah, we'll still keep the items separate. I just wanted to clarify that we'll forego both verbal reports. One of the grievances in the latest inmate hunger strike called for, quote, having grievances and appeals responded to with more substance than issue resolved. And I know that this has been an ongoing request from inmates and advocates. Can you tell us where we are on expanding this process and providing more substantive responses to inmates?
Chair Ellenberg, we also have with us Lieutenant Joe Nguyen from the Grievance Unit, and he will be answering some of these questions.
Terrific. Thank you.
Good afternoon. Am I audible right now?
Yes, you are.
Make sure. Okay. Good afternoon, supervisors. In regards to the grievances that you're mentioning from the hunger strike, we received roughly 40 grievances from that housing unit during the time frame. And with all of our partner business units, we provide a substantial response to each grievance. So when an inmate receives his or her final disposition for a grievance complaint, the paper given to the inmate physically by the sergeant will have the inmate's name, associated information, incident location, the current location of the inmate, and also 6 possible grievance disposition options. And they're checkboxes, and one is resolved, one is administratively closed, unfounded, non-actionable, released prior to resolution, and duplicate grievance. So after a final disposition is selected on one of the checkboxes and resolved as one of them, a summary of the response is explained to the inmate, usually from a custody sergeant or a business unit manager. The grievance unit does not accept, allow, or approve one-word answers. The functionality and meaningful response is accompanied resolution with an explanation for the inmate. To take a step further, we do require the sergeant that's passing out the resolution that if there is a language barrier or some sort of difficulty, that the custody supervisor will provide an interpreter to ensure effective communication has been established with that inmate when they pass out the grievance as well. So at the end of the final disposition on the bottom of the page, our grievance unit management analysts, they usually sum up the entire grievance for the inmate. And that's usually the grievance unit response, and that acts as a conclusion for the inmate. So they'll summarize the complaint, the sergeant that's answering, and then they'll provide a conclusion for the inmate as well.
Is this a new protocol?
No, this has been the same since I've been assigned to the unit.
So then I think there's clearly a a disconnect here, and I don't know if there are advocates to speak on public comment, but it sounds like that's not the message that's getting to inmates, because of how do we address, or how do you reconcile the information that you're describing is being provided with inmates' grievances repeatedly over time, that they only see the grievance resolved or issue resolved comment?
I'm not sure if it's miscommunication or, but the resolve part is merely the disposition. That is just a checkbox that we offer on the page, but the page has a summary up top. It has the accompanied explanation from the supervisor. And on the very bottom, there's also a grievance unit, a summary of what transpired throughout to explain to the inmate. So resolve is a option that is a checkbox on the page. But I can assure you that all the ones we review, we do not accept one-word answers. We seek meaningful responses for every single grievance that we encounter and process.
Do the inmates get to keep the grievance reports? Could someone, for example, show, what I'm interested in seeing would be a grievance resolution from an inmate that they find to be inadequate, exactly what that looks like, and what your forms look like to see if we're possibly talking about different things here. Could you provide to the board a couple of samples, obviously entirely de-identified, but some examples of what grievance resolution forms look like, please?
Yes, we
yes.
happy to do that. And so we're very clear that every grievance that is provided to an inmate in response has to go through our management analyst review. And if there's not a narrative explanation associated with the response, it will not be forwarded to the inmate. It will be rejected.
Okay, and do the inmates get to keep those papers?
Yes, ma'am.
Okay, so maybe we'll have an opportunity to dig a little deeper here, because it sounds like there's a clear disconnect between what you're describing and what inmates have been consistently grieving about. So I'll look forward to seeing those, and I'll see what I can get from inmates as well, and see if we can resolve that. Thank you. I do want to thank the department for tracking the grievance data over 2020 to the ADP. This really does provide a much clearer picture of grievance trends during the pandemic. So thank you. I would like to suggest one additional change. For the chart on slide 7 in the presentation, there's trend data for each facility, but the data is compared to the total ADP for all facilities, which masks facility trends somewhat. In the next report, could you please break out the grievance data and compare it to the ADP for each respective facility?
Yes, we can do that.
Yes. Okay.
Yes.
Great. Thank you very much. I appreciate that. And I'll look forward to seeing some de-identified samples of grievances that have been resolved. Thank you. Do we have any comments or questions from folks on the screen? Do we have any public commenters?
Yes, we have 3 individuals wishing to speak at the moment.
All right, thank you.
Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute, and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everyone. Scott Largent. I am still kind of curious what happened with Simple Rose. That was the woman that filed many different grievances that was not taken to civil court. Robert Aguirre and I got pretty actively involved with Rose and her situation, but we were basically stonewalled by the public defender's office, several of her attorneys. She did put us on as a point of contact, gave approval for us to discuss her mental health issues, her court issues, you know, the whole 9 yards. So what I'm still concerned about is why somebody hasn't done the right thing. Why none of you have not maybe reached out to a friend or coworker or, you know, somebody that's an attorney that could do some volunteer work to file, basically to get her another court date, to get it in front of a judge to reverse what happened to her. And our public defender's office, of course, will not do anything on a civil level. So they will not unwind what happened to her. Now, what happened with these grievances? She kept filling them out. She kept, you know, saying, look, they're not taking me here. They're not taking me there. Now, I know Rose can be kind of a pain. I was able to see all the different grievances. That was good that there were copies of those that were provided to her. Over the time, those things have been taken in sweeps, and luckily enough, I had photographs of them from the cell phone. Then I would also like to figure out if the grievances were ran through involving being put onto a bus and taken out and dumped at the Great Mall during the George Floyd protesting. I want to see if that stuff's been taken care of. I know that's an internal affairs complaint. I guess technically it would be a grievance also. And I'd also like to figure out why activist Sean Cartwright was stuck on a bus and taken out to Eastridge Mall. And she was put on a bus after there was about 60 people on there without wearing masks. So that seems kind of mean to kind of shut her up. So thank you.
Our next speaker is Irvish. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much. I wanted to let the Public Safety and Justice Committee know about that. That in the real world, how the inmates, be secured, and be also, to make sure that how the internal as well as external environment be safe. It is important to understand that in terms of evaluating that what are the security measures and to be implemented for the public safety and as well as the justice system, to do that whether the inmates are safe or not. There are measures already being implemented over the internet. There are already measures being implemented at different systems. The public safety and justice is not just limited to space. It requires to be implemented at the internet level as well. The security and safety is required at the internet level as well. So over all the computers, so over in the space. The only part about implementing the safety, that how it is to what it takes to implement that safety. It is about knowledge, a knowledge from a person who understands that how the concept of our internet security as well as the space security as well as the real world security differs from each other, and then to implement those for the respective government agency as well as the law enforcement agency to understand that it is not that something it is the knowledge that requires to implement such standards, and also to implement the right set of a justice and juvenile system to protect the identity of a person in the real world as well as in the space world as well as over the internet, over the computer. The identity theft is becoming a more and more issues in terms of a public safety as well, and for the justice system as well. So please, consider to implement, such thing. Please consider to implement the public safety and justice system as well as security in terms of every world scenario where right set of technology implementation is required, so that
Our next speaker is Ron Hansen. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, supervisors and committee members. I am Ron Hansen, affiliated with PAC, People Acting in Community Together. I'm pleased that the Sheriff's Office has agreed for the first time to include some average daily population data with their number-rich quarter grievance reports. And I'm pleased just to hear now that the department will include by facility ADP numbers in future reports. Indeed, by folding in by facility ADP, the true value of grievance reports may finally be realized. The report shows Elmwood women's medical grievance numbers to be lower than either Elmwood men or the main jail. However, when facility population is folded into this data, we see that our incarcerated women grieve their medical service anywhere from 3 to 10 times more frequently than our incarcerated men. In January of last year, for example, 1 of every 7 women filed a medical grievance. Indeed, throughout all of 2020, on average, 1 of every 12 Elmwood women filed a medical grievance each month. This compared to just 1 medical grievance per 30 main jail detainees and 1 medical grievance per 50 men at Elmwood. Collecting and reporting numbers has negligible value unless doing so correctly identifies actual issues and drives corrective action. All the elements are available to the Sheriff's Office for this to happen. For the well-being of the men and women in our jails, I urge the Sheriff's Office to report grievance rates per facility in all of its future grievance reports. Thank you.
And that concludes our public comment.
Thank you very much. Are there any additional comments or questions? If not, we'll move on to item 9, which is to receive a report, which we've already received in the agenda, from the Office of the Sheriff relating to academy recruitment and staffing levels. Supervisor Wasserman, do you have any questions on this item?
Yes, or question comment type. I read all the detail that was provided by the sheriff and her office, and all the barriers that she's facing in getting as many people as we need to provide the safety the Sheriff's Department is expected to provide. And I know over the years, this is my 11th year now, I know when I first got here, there were several academies, then there were very few academies. Then we got back up to 2 or 3 academies again a year, and that was great. We had people, when San Jose was having its problem, we had people transferring over to ours. Then we hit kind of a high point in people becoming of age to retire and retiring. Then we had nationwide a 180-degree change in public opinion of law enforcement, and also the reduction of individuals thinking of law enforcement as a career. So I appreciate the staff report. I understand the myriad of obstacles that the sheriff faces in getting enough people. And I also, as I've touted for 10 years, I think it's tougher to get into a sheriff's academy than it is to get into Stanford. I won't make any comments about USC because that's where I went, but I'll stick with Stanford. It's a tough situation. I was glad to see this on the agenda today, Madam Chair, as far as having an opportunity to hear from the Sheriff's Office. And there was much more detail in here. And again, you've got the whole COVID time. I mean, things there are dramatically different. And then you throw in I think we're down to a $200 million deficit now. And that's after doing away with all the funded vacant positions in the Sheriff's Office. So through the chair, what I would ask the sheriff is, my question would be, how do you see this turning around? I mean, obviously, if our deficit gets worse, there'll be further cuts. When I started here 10 years ago, we had 14,000 people. Now we have 22,000. The budget then was 3 to 4 billion. Now it's 8 billion. So I'm hoping there's not a lot more downside, but I am hoping there's some more upside. And I'll ask through the chair, this will be my long-winded question, is what ways do you see, Madam Sheriff, to improving the number of people that apply to work for you, to work for the Sheriff's Department, to apply to the academy, given the constraints that we've got? And I just see financial. This COVID thing's going to be over. But financially, I think we may have a couple more years at these levels before we can restore things the way they were just a year ago. Thank you, Madam Chair.
I think in answer to your question, Supervisor, right now, the county is not even accepting applications for deputy sheriff, either correctional deputy or deputy sheriff. And I think you mentioned earlier about budget concerns. I think we need to look at what the county's core services are, what our mandates are, and apply budget cuts in accordance with those concerns. I know that we do a lot throughout the county that may not be mandated. I believe that the Sheriff's Office took an exceptionally high number of cuts proportionately. And I think in my document, I point out that not only did we take a proportionate high number, but the last 4 years of growth in the sheriff's office has been very, very low. So I think there needs to be a look at mandates, a prioritization of services, a review of which departments have grown considerably in the last 4 years, and look at the disproportionate amount of cuts that were taken in the sheriff's office. Now, the document that we provided was really my analysis along with our fiscal people and personnel people. So if there's any errors in what I've done, I sure would like an opportunity to review that and make any kind of corrections. But it to me appears that we've taken a disproportionate number, that we really now are at a risk of not being able to provide mandated services. And in our non-jail budget, we were hit exceptionally hard. And I think that really risks our ability to not only provide mandated services, but also to be able to provide the legally mandated investigative functions. So we now are being hit with another, I think, 5.5 million, maybe 6.5 million cuts. And I don't see where we can take additional cuts. So I would urge this committee to forward this report to the full board for consideration, and to really, really look at better ways to assess budget cuts in a fair manner, and considering everything I already talked about.
Thank you very much. One more question, if I may, Madam Chair. Thank you. Yes, I understand what you're saying now, Madam Sheriff. And I know when we cut the dollars of the funded vacant positions in yours and DA Rosen's office, there were concerns like that. I also know we've still got $200 million in deficit that is certainly going to go into next year, 21-22. You did mention something that I don't recall being aware of before, that you were not allowed to hire any more people. And I know there's people that retire. Your workforce is a large one, and so you have a larger number of people that retire, as happens with larger workforces. But did I understand you correctly that even with people retiring, you're not empowered at this time to hire new people?
Correct. So if you look at the freeze exemptions that we requested, probably we were not able to hire into 80% of those. Also, I just got a new report in the last couple of days that comes from the county, and it looks like that number is even greater than 80% denial on exemptions. So not only, and county personnel has cut off the application process for deputy sheriff and correctional deputy. So we're not even accepting applications. And I know in my report, I can't remember the number right now, but I think it's between 80 and 90 people left the sheriff's office last year. So in the report, we also show the huge number of people that we put into academies and how the next few academies are going to be zeros. So we're behind the curve in the county not taking applications, exemption requests not being approved, and the number of people we have leaving the sheriff's office based on last year. So we are way behind the curve, and it takes 9 months to hire someone, and then another 5 to 8 months for the academy. So we don't even see people for 18 months.
Understood. Thank you. I understand that it sounds like a plan of attrition to get the numbers further down. I just hadn't, I'm sure it was presented to me. I just didn't recall the fact that no academies are happening. Thank you, Madam Chair.
Thank you very much. I appreciate getting the report. I want to take this in a little bit of a different direction and kind of raise some concerns that I hear from the sheriff in this report and that I've heard from other departments regarding ESA and their often seeming refusal to cooperate and communicate with departments when it comes to specific code deletions. What I've been told, again, anecdotally from different department heads, is that ESA generally doesn't allow for departments to recommend alternative codes for deletion, to swap one code for another, or to offer alternatives that would meet administration's advised cut dollar amount while minimizing the negative impacts that a cut could have on their department. Administration, budget department, and board concerns, in my view, should be based on the numbers, the dollar amounts that are needed to make the budget whole, and not on specific codes, especially if the subject matter experts, the department heads, in this case the sheriff, are saying that these are critical positions and are offering alternative codes to be deleted. I think that's in part what the assessor was trying to avoid preemptively by offering his own cuts. As a budgeting principle, the administration should be focused on overall numbers and trust department heads to make decisions they need to run their departments. I certainly think that we as a board can question departments if we see poor outcomes, but when that's not the case, then a view from one supervisor is that departments should be offering the codes they think could be cut without or with the least significant impact to department performance or services to the community. So there's no question in there. Sheriff, the report just triggered an all too common theme that I'm concerned about. So I wanted to raise that on the record.
Thank you, Supervisor.
Could I respond to that?
Oh, absolutely, Dr. Smith. Yeah.
I just want to clarify a few things. First of all, it has nothing to do with the ESA. What is being referred to is the response that happened after the voluntary separation implementation program. Mm-hmm. And remember, the board and under our recommendation allowed people to separate with an incentive. And we made the commitment that we were going to delete those positions after they separated, because that's really the only way to save the money. Some departments were able to make suggestions of alternative positions to be deleted. Mm-hmm. ESA was not the decision point. I was the decision point. So I just want to clarify that. What happened is that some positions that were suggested were appropriate and they were substituted. Other positions were not appropriate. They were not substituted.
Who makes the determination of whether they're appropriate or not? Why would that determination not lie with the department head?
Because they have to add up to the right amount of money.
Okay, but given
not all positions are equal in amount. Fair
enough. But is there a policy reason why we don't give just a dollar amount, reduce your budget by this, by X, as opposed to eliminate specific codes if they're not in line with what the department believes will enable them to best continue to manage?
Well, this is a result of the VSIP process. And I can tell you that there are some departments that are challenged by the number or the particular individuals that separated. But, it's a matter of finding the way to save the money.
Sure, Dr. Smith, respectfully, this is something that was an issue long before the VSIP. This was just in general. Hearing over the just over 2 years that I'm here, hearing frustrations that just sounded similar to what was expressed in this report of department heads being told to cut specific positions as opposed to cut by a dollar amount. There had been situations where they had offered other positions instead, willing to make that same dollar amount, and had been rebuffed. I have been led to understand by ESA. Maybe it is by you. And maybe that's something to explore, not at the end of a longer meeting, but to follow up. And I don't know if there's a referral or appropriate place for conversation, but I'm happy to talk more about that.
Well, I guess what I would say is we're happy to respond to the subcommittee with specific rebuttals to the assertions that the sheriff has made. But of course, we can't do it verbally today. Sure. But if the committee would like us to respond back, we'd be happy to respond back.
Great. I think that would be a great opportunity to play out one of these circumstances. So yes, thank you very much, Dr. Smith.
Okay.
Do we have public speaker? Does anybody else want to speak to this item? Do we have public speakers on the item?
Yes, we do. We have 3 members at the moment.
Okay.
Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute, and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, everyone. Scott Largent. I would be concerned right now in our county about losing sheriff's deputies, as in going to different departments, possibly leaving the state, and getting just frustrated with a system that's not really working properly. Now, our top cop in Santa Clara County is, of course, you, Jeff Rosen. Now, these deputies, and not just the Santa Clara County Sheriff's deputies, law enforcement in general, the feedback I'm getting from all these officers is that you don't have their back. And what I'm getting at right here is that the last civil protest, sheriff's deputies were spit on, they were hit, they were assaulted. I mean, what is it? Assault, battery, you know, we're in a pandemic, so basically them spitting is pretty intense. They held the line, they were professional, they did a fantastic job. The people that did this to these officers, you need to hold them accountable. And the problem is you're going to give them a free pass. It's the same thing that happened in Sam Liccardo's front yard. The agitators that take over these protests, okay, they're the ones that start trashing the courthouses. They're the ones that start fires. They're the ones that start threatening people to kill them and, you know, whatever they want to do. And they're agitating the crowd. It's your responsibility as our DA, as top cop, to go after these people. Okay, let's do the right thing. So law enforcement wants to remain in California. They want to remain in Santa Clara County and not just take a big trip to Texas to get out of here, where more likely the top cop will protect them there. It's just sad when I looked over a lot of these videos to see the good men and women that work for our county. It's just sad watching this stuff. You need to do the right thing, Jeff. You need to prosecute the bad apples.
Our next speaker is Irvish. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. From academy perspective, I wanted to say that on item agenda number 9, that from academy, from recruitment and staffing level perspective, it is very important to evaluate that, you know, what every individual is going to contribute to the system. Every individual has their ability to contribute, and they contribute based upon their ability and the skill set they have. There was a concept about the communism in the China. The communism states that you know, the person contributes to the system as per their ability and then as how they go. The concept of a socialism differs from the communism. As you know, more people, you know, get together, it becomes social. They learn the things, they learn the skills from each other, and then, you know, they implement the abilities, you know, that they have to, you know, work upon. However, you know, it is important that every individual which is contributing in the system, they're required to conduct a certain set of a work as per the open government bylaws, and as well as, you know, depends upon the law enforcement agency, you know, they are a part of. Other than that, there are also things, there are also certain unknown things, you know, sometimes, you know, individuals would have to go through, they have to understand that, you know, what are the concepts, you know, they have to work on. Not every concepts, you know, work, you know, in this entire world, there are different individuals, there are different people, they have a different behavior. they have a different a different kind of a characteristic. So it is important that, to understand those characteristics, important to understand that behavior, and based upon that, the individuals, be allowed to participate in the academy and learn those things as well. The concept of a space, concept of a internet, concept of the concept of prevention and implementing a public safety and right side of a justice system is required to be implemented in the all government bureaus, so that the academics as well as the recruits, they understand that what it takes to develop such thing.
Our next speaker is Shelley Lacer. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking. Shelley, can you please unmute yourself? Okay, we'll move on to our next speaker, Robert Aguirre. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
This is Robert Aguirre. I again want to talk about something that I've talked about over and over again, that we need to have a court specifically for the unhoused, for the poor, because these are people that are subject to many of the laws that are specifically designed to single them out. For example, you have fare checkers on VTA, and if you're a person that is a person of means, you can afford either to not take the VTA, take your own vehicle, or if you do take it, you can afford to buy a monthly pass or just pay for every trip that you get on. So the only people that ride VTA without having money are people that can't afford to pay it in the first place. And they're the ones that are being targeted. So we need to have a court that's set up to be able to deal with people that have these situations, so that we can understand better as to why they're doing what they're doing. I don't think people ride the VTA just because they want to have a free joyride to go around the city. I think that they're doing it because they have to, and they have no other way of getting around. We also have a lot of people that are being charged with trespassing. And as I've reminded many people, the unhoused, wherever they are trespassing because they don't have any property of their own. And it's unfair that they get added these number of trespassing tickets, one after the other after the other. The police just target them. And then they end up having to go and plead this down to something else because they've got 6 or 7 charges of trespassing on them. And so they're told, well, you can go on to Judge Manley's court if you will drop 5 of these and we'll only charge you with 1. And they end up getting stuck in that whole Judge Manley trap. We need to change that whole process as well. So again, I beg of you to please consider setting up a special court for people of less means and people that don't normally get representation, and they rarely show up for court because they know that they can't afford to pay it anyway. And it's just a vicious circle that gives people a reason to get pulled over.
Our next speaker is Shelley Lacer. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, I'm reserving comment at this point. Thank you.
And that concludes our public comment.
Thank you very much. Anything further? No. Then we move on. Sorry, Dr. Smith, I just want to close the loop on the request for the report. If we could get it before Tuesday, that would be ideal, please, because this issue is going to come up again at the mid-years. And I was remembering, I knew that there was another specific situation recently that happened. The district attorney brought up a similar issue during our last budget conversation. ESA had recommended codes to be cut that weren't even funded through the general fund. District Attorney Rosen offered alternate codes, which were denied, and ultimately, if you recall, it took a board action to respond to him. So that's where this is coming from. Numerous other examples, and I would like us to get some clarity and clear policy before moving into the mid-year budget, so that we can address this very clearly and transparently.
Okay, I do want to make it absolutely clear. It's not ESA that makes the decision. It's OPA.
Oh, I'm
So
sorry, I keep using the wrong
budget,
term. Okay,
ESA doesn't make any of these decisions. They're all budgetary decisions.
okay, thank you very much
I
for
know
that.
that some of the departments have a hard time distinguishing the two, but it's all made by budget.
Okay, well, perhaps then I appreciate that. Seeing the report before the board meeting again would be ideal. And if as part of the budget workshops and conversations, it would be important to distinguish between ESA and OBA, that would be, I think, a useful bit of information for us as well.
So let me make sure I understand. You want a response to the sheriff's report?
Specifically, yes. Yes. Prior to the board meeting on Tuesday. And then as we go into mid-year, including in the conversation around budget, the policy of department heads being able to choose who they keep and who they cut, as long as, well, hopefully cutting nobody, as long as they meet financial goals.
Okay, I'm sorry. I'm hearing two different things. One is a response to the sheriff's assertions. One is a bigger question about the budget.
Correct. Yes, correct.
So which do you want by Tuesday?
Just the response to the sheriff.
Okay.
And then when we have the mid-year budget conversations, I would like that to be teed up as part of it, please. The second request. The bigger question about department heads making determinations as to which codes they keep and which they cut.
Okay, we're going to have mid-year discussion on Tuesday. So you mean you want it as a part of a verbal report?
Yes, please. I thought we were a week or so away from that. Yes, thank you.
Okay, sure.
Okay, I appreciate that. All right, we are at item 10, announcements. Do any of the department heads have announcements or information to share? I will be very brief in mine. I want to thank all of the departments for recommending some really excellent study session topics for consideration this year. As many of you, I suspect, are aware, the Board of Supervisors is in the process of finalizing a plan to engage the public in conversation under the rubric of care first, jails last, so that we can determine whether the construction of any type of new facility would serve the greater interest of public safety in Santa Clara County. And as part of this effort, the Public Safety and Justice Committee will play a leading role in supporting that community engagement and reviewing reports and recommendations that are to be made by an expert external facilitator. So in light of this, I'd like to put the study sessions on hold until we have more information on timing and the impact to the PSJC work plan for 2021. It is likely that our study sessions may be singularly focused on this critical conversation. The board is anticipating an update by administration at the upcoming Board of Supervisors meeting, and Yvonne Jimenez from my team will provide all of you with an update once we have more information. And last look around for any final comments or announcements.
Madam Chair, I see one person's hand raised. I don't know if that's an error or if that's intentional.
Oh, can you say who it is, please?
No, it just shows one hand raised.
It's a member of the public wishing to speak.
Oh, yes, this is an item because we have comments on item 10. Yes, go ahead, please.
The next speaker is Irvish. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much again. From a Public Safety and Justice Committee perspective, I also wanted to mention that all the meetings that is being conducted over Zoom, there is a federal with the FCC, with the Federal Communication Commission. There is a report that has been filed by the commissioners to the FCC with regards to the Zoom's deceptive and security practices, which is called a Zoom bombing. on a lot many occasions when on a public meetings, which are public, and it is known to the since meetings are conducted by the government, these meetings being conducted are being recorded, and as well as the notes are being taken. However, it is important that when the meetings are being attended by any public speaker or any public individual, it is important to know that who is logging into the Zoom meetings, and also it is important to evaluate that what are the conversation that are being taken place. Also consider also required to be secured at all times. Zoom bombing and Zoom security practices, the deceptive security practices are being on an internet, and as well as for the video conferencing nowadays are very commonplace practices, and they do happen in very tandem that they try to hijack and try to hijack the meeting sessions. So it is important that the right set of standards be implemented by open government laws, and as well as any such practices which is disrupting any such meeting sessions, they are being reported to right set of law enforcement bureaus, so right standards be implemented. Again, I wanted to emphasize that how the on a standards to be implemented as well for the meetings to be conducted with the ethics, discipline, and integrity by the open government laws over the virtual platform as well. Thank you.
And that concludes our public comment.
Thank you very much. I just want to make a very quick general public service statement reminder. When public speakers are talking other than on public comment at the beginning, the comment should be limited and directed to the specific agenda item, which is precisely why we offer public comment with regard to every single item on the agenda. So hoping that members of the public will follow that, and if they're going to speak on public comment, to please address the item that's before us. With that, we will adjourn this lengthy meeting. Thank you all for your patience and contributions, and see you on March 4th, 2021 at 2 p.m. Have a good afternoon.
Good afternoon, everyone.